You dramatically involve the treatment of cancer cases. You have healed hundreds of cancer patients. Could you please tell us in short how to treat cancer in comparison to normal chronic diseases? You told me that we need mostly two different remedies. Can you please tell more about cancer treatment?
See, for this I would like to tell you first of all that my cancer research is not complete, and it's wrong for me to say that I've cured hundreds of patients. I may have cured many, and I'm on the way towards a very big opening into the mysteries of cancer. But basically, if you go to see the definition of cancer is in your books of medicine. The basics, basically it is defined as a corporeal disease of the body, disease of the corpus. Now, it is first of all very important for us to understand that human being is made up of two things, material and immaterial. That means the material being or organism which goes on multiplying from one cell to many cells in the womb in the first 4 months. That is where the body or the material body is being shaped into with our head, foot and all the organs in place. They are still not working. After the 4th month comes the entry of or activation of the life force from wherever it comes, we do not know. But then there is matter, the material body, in which we are adding to it something vital, and that's why he says vital force. It's not an energy, but it's a force which is now making it run. Having understood these two things, that human being is made up of two things, one material and immaterial. After the birth, of course, it gets its own mind and it goes on to live its own individual life. But when there is a cancer which is visceral, which is more of corporeal, it has nothing to do with the mind. Mind of the person can initiate the cancer, can make it a starting point. But once the body cells starts multiplying, whether it is the bones, whether it is the lungs, whether it is the liver, whether it is the whatever part in the body, kidneys, etc., it's the parenchyma which is multiplying. It is the bodily structure which is multiplying. And this body structure was built by the synthesized or created by the body in the first 4 months, when there was no element of the vital force or the mind, the immaterial. So we have to attack first the material side of the material part and treat it from that point of view. And once we have understood this, or once we have treated this, then the patient as a whole has to be treated. So first part is treating of the cancer itself, that means the viscera or the structure of the body. And the second part will be treatment of the patient as a whole, so that it does not again relapse. That's why this cannot be cured with only one medicine. It has to require two medicines which are in some way related.
Which would be a cancerous remedy,
No.
and then the constitutional remedy.
Not cancerous remedy. I never said cancerous remedy. Cancer is a disease which is multifaceted. But again, this remedy will be covering the miasm. The miasm. It can be sodic in case of leukemia, in something which is coming suddenly, going suddenly, acute ALL and AML. It could be psychotic growth or it could be destructive also. And every tissue gives a cancer in a different, expresses a cancer in a different manner, depending upon its origin. I think, we have not taken this into this thing, but the ectoderm always goes into destruction. That means the skin and the nervous system never develop into tumors. The endoderm will always develop into tumors. Mostly the endoderm goes into multiplication always and develops into tumors. So ectoderm always destruction, endoderm always construction, and mesoderm we have got two parts. The old mesoderm will always multiply, the new mesoderm will always get destroyed. So the tumors will be in endoderm, the old endoderm, endoderm itself, and old mesoderm, whereas destruction will be in ectoderm and the mesoderm part, which is new mesoderm.
Interesting.
So it will be different in different places. So don't call it cancer.
Yes.
It's always a defense mechanism. Cancer begins as a defense mechanism. So we have to see how and where this patient was trying to defend itself. And in what way? By creating ulcer or creating excessive multiplication.
Okay. Another thing I would ask you, you spoke about the mind of disease.